Hello everybody. Today we are going to discuss about a billion-dollar question which all the patients ask us each and every time. Even the physicians ask us this question, and I get this from people who refer me patients for weight loss. And the question is, what should I choose for my weight loss? You offer drugs for weight loss, you offer allurion, swallowable capsule, an endoscopy for weight loss, and you also offer surgery for weight loss. Now, which treatment should our patient go for? We get this question from our patients who approach us for weight loss, from physicians who refer us patients from different parts of the world, and also our peers. And to be very honest with you, we were never able to find out a very simple answer to give to most of our referees or who refer us these patients. But today I am trying to find a very simple solution, a very simple answer to this problem, which all of you can take back and can guide patients in the light of this solution. Again, an expert healthcare advice is always important than these videos, but still I'll try to solve this problem or this question. So we have drugs, we have allurion, oblique endoscopy, and we have surgery. Now how to choose between them? So, whenever anybody asks us this question, my answer to that question is again a question, that what do you want? And the answer to this question lies in this question, that how much weight loss does the patient want? Whether he wants 5 to 10 kilos, or he is desirable of 10 to 15, 15 to 20, or more than 30 kilos. That's a very important question we should ask each and every patient. Now, the more amount of weight loss you would want, the more would be the invasiveness of the procedure. Let's assume somebody would want 5 to 10 kilos of weight loss and he is happy. The other individual is not satisfied with that kind of weight. He wants 20 kilos. As a surgeon or as a healthcare specialist who is offering weight loss treatment, I cannot offer same modality to each and every patient. Again, the caveat here is I am not saying that with a modality which gives just 5 to 10 kilos of weight loss, you cannot reach this dream figure. You can reach this dream figure of 30 kilos even with modalities which offer you 5 to 10 kilos of weight loss. But realistically, scientifically, and data-driven knowledge suggests that out of the procedures or drugs I am going to offer, they will fit into these ranges. Let's discuss about what modality will give you what amount of weight loss, which can help you solve that problem inside your mind, what you should choose. So let's start with 5 to 10 kilos, which is like the basic thing, which I think every household has an individual who is overweight who would want 5 to 10 kilos of weight loss. If you search people around you, every one of us, would want that kind of weight loss. I mean, there are, actually I cannot find people who would not want this range of weight loss. Now what to do for these kind of patients? Again, for all these kinds of weight loss, lifestyle modification is mandatory, which means eat a healthy balanced diet, sleep 6 to 8 hours, avoid alcohol, smoking, and several other things, and fourth, exercise, if not daily, at least 4 times in a week, right? So I'm not talking about that lifestyle modification. That applies to each and every of this procedure, and if you do it, it's the best. But as a healthcare expert, as a bariatric surgeon, as a weight loss solution provider, apart from lifestyle modification, which all of you are doing, I know all the patients who approach us are doing gym, they've tried different kinds of diets, the keto diet, the hundreds of diets. The paleo diet, I'm not gonna name the diet. They've been to a gym, they've been to different kinds of diets, they've been to different meditation and different naturotherapy programs, herbal therapy programs. They're all good. If you have tried them and if you have failed on them, or even if you are doing them and you are not getting successful, or even if you are successful, you want something stronger, where you want 5 to 10 kilos, 10 to 15 kilos, 15 to 20 kilos, more than 30 kilos, we have a solution. Now let's talk about the solution. So if you want 5 to 10 kilos of weight loss, the best thing would be to go for weight loss drugs. Now all these drugs are used in US and Europe, and some of them in India, for weight loss. I'm not going to go into the details of these drugs, but the good news I have for all of you is that I have accessibility to all these drugs for all of you. So if you want these drugs, we have a medical weight loss program which will provide you these drugs at your home. Not only that, we will be providing you these drugs, we will also be giving you a complete diet plan, consultations with me virtually and with our multidisciplinary team to help you maintain your weight. 5 to 10 kilos, most of these drugs gonna benefit, and you can use these drugs and register to one of our medical weight loss programs. Now, if you want more, just in case, if you want to go into the category of more weight loss, where you would want weight loss in terms of 10 to 15 kilos or maybe more, we go to the allurion technology. Now, what is the allurion technology? It's the swallow capsule. So it's the swallow capsule technology here. As you can see, this is the capsule which you swallow and it converts into the balloon. Allurion claims, and it's a CE marked, approved, and also approved in India, to give 10 to 15% of total weight loss. So that's maybe is a little stronger than the drugs available, and you can avail this particular treatment. If we combine allurion with those drugs which I mentioned previously, the weight loss comes in the range of 15 to 20 kilos. So 5 to 10 kilos, the drugs, 10 to 15 allurion, and combination of both 15 to 20 kilos, which is what our own data suggests. So let's go back to the first slide. If we go to the first slide here, we have this category which is solved by drugs, and as I said, the drugs are available in my own program, which I will provide you along with diet plans and consultations with me, how to use those drugs. 10 to 15 kilos, we have the allurion which comes into play, and that also we provide. We are the first one to bring them into the country, and we have a dedicated allurion program for you. A combination of these two, drugs plus allurion, will take you to this range. This area here would be drugs plus allurion, 15 to 20 kilos. Still not close to bariatric surgery. Close but not close enough. But if you want more than 30 kilos, then the final solution you have, and can I have that slide, is bariatric surgery. So if we go here, we see that there are three kinds of bariatric procedures: a gastric sleeve, a gastric bypass, or a mini gastric over anastomosis gastric bypass. These procedures have capacity to give 30 kgs plus of weight loss. So that's the kind of weight loss we are looking at. And if you want to do this or this, these procedures are very strong. They are laparoscopic, they are being done by laparoscopy or by robotics, and these are the procedures which give huge amount of weight loss. Now, I again simplified it very well, but these are the important questions which our patients ask. When I put them, drugs 5 to 10, allurion 10 to 15, combination of drugs and allurion 15 to 20, and surgery more than 30. Now, when we put this, these are the questions which might come to your mind, and this is the most important question which everybody asks: which is permanent? Let me be very honest with you, all the procedures will require lifestyle modification. But if we talk about the longevity or the duration of time when most of these procedures would work, like 5 years, 10 years, 15 years, 20 years, bariatric surgery has data of 50 years. So bariatric surgery, if you do, it has long-term success rates and the weight is maintained over a prolonged period of time. Compared to it, I'm talking about 50 years, compared to it, if we see other procedures, I'm not saying that they fail after 4 months or 6 months or the moment you stop the drug. Like patients ask us the question, what happens when my balloon will pass? What happens when I stop the drug? The last two questions if you see. I'm not saying that you gain all your weight back once the balloon passes off in the motion or you stop taking those drugs. No, you do not regain all your weight back, but they are not as strong in weight loss maintenance as bariatric surgery, right? So yes, the permanent nature, the robustness is more in bariatric surgery. Balloons and medications are more strong when you take them. The moment you stop them, you need to stick to a lifestyle modification. I'm not saying patients gain all their weight back. Most patients maintain it because they learn how to modify their lifestyle. They learn the art of early satiety and they learn the art of eating less and feeling full. And that's the beauty of a balloon or a drug. But still, if you compare its robustness with bariatric surgery, surgery exceeds. Now, which procedure has more complications? How many days do we have to stay? And long-term side effects. That's the last thing I'm going to address. I'm not going to make it complicated. Obviously, there is no stay in the hospital for allurion and drugs. Drugs can reach your home. We can do virtual consults. Allurion can be done at any of your cities. You need not even come to our center. And it's an outpatient procedure. For hospitals, for surgeries, you need to stay in the hospital for around 48 hours, which is important, which all of you should know that it's an admission procedure done under general anesthesia and you need to stay in the hospital for 48 hours minimum. For allurion or for drugs, no surgery, no endoscopy, no anesthesia, everything on an outpatient basis or you sitting at your home, right? Complication rates, surgery has its own set of complications, which in our own series I already mentioned in many videos, 0.0002%, because we are probably one of the largest volume center in Asia Pacific, if not the world. So again, surgery will have its set of complications depending on the surgeon you are going to get that surgery done from. I can only talk about my center and my data which we published, and I said 0.0002% complication rate. If you talk about long-term side effects, you need to be on a multivitamin supplementation and protein supplementation for minimum of 6 months and maybe prolonged duration when you do these surgeries. So the message you get is, we'll again go back to the first slide. The message you get is that the more you wish to get in terms of this thing here, weight loss, the more you want, the more you should be prepared for. So if you want 30 kgs, you need to be prepared for bariatric surgery, for 2 days of hospital stay, for 6 months of multivitamin and protein supplementation, and depending upon the surgeon's experience, the rate of its known complications. But it's the most powerful tool, the bariatric surgery, the most permanent tool, the most robust tool, and the most tool which gives the most significant amount of weight loss. Again, if you are anti-surgery, if you don't want surgery, you don't want any modification in your GI tract, yes, the drugs and the allurion technology are available, but they have their limitations where they fall only under this bracket of 5 to 10, 10 to 15, 15 to 20 kilos. This presentation, dear friends, is a little simplified, but let's keep things simple. If you want to explain it to anybody, you can share this presentation as to what they should expect. Talking about side effects of these drugs or allurion, the drugs have very minimal side effects ranging from nausea, vomiting, insomnia, dry mouth, depending upon which of these drugs you take. So we have different drugs here. We have phentermine, we have naltrexone, bupropion, semaglutide, which comes in injectable form by the name Ozempic, and tirzepatide, which is a very new drug, which still most patients would not know about. But depending upon these preparations which we use, the side effects would be minimal, but they would be there. And if we talk about the allurion technology, again, for the first 48 hours after the implantation inside the body, a little bit of foreign body discomfort. So in nutshell, the more aggressive you are in terms of your need for weight loss, the more you have to be prepared for hospital stay, supplementation and complications. And the less you want, the less are the chances. So thank you very much. This was a very short presentation to give you a brief about what you should choose, how you should choose and what you should expect. Thank you.